Heart Health Awareness Month may wrap up today, but the awareness lives on. And this morning, doctors are talking about a common heart condition. In this week's Doc Talk, CBS 21's Chris Allen tells us how technology is making great strides in helping patients with atrial fibrillation.
The following segment is sponsored by Geisinger Holy Spirit.
Atrial fibrillation is characterized typically by very rapid and irregular heartbeats.
Also known as AFib, which is more common than one may think. Safwat Gassis is a cardiac electrophysiologist at Geisinger Holy Spirit.
When there's any abnormality of the heart's electrical system, the heart's pumping function becomes compromised, which leads to the symptoms.
Arrhythmia is the main symptom, characterized by periods of irregular heartbeats, which tend to be intermittent.
Which means the arrhythmia comes and goes. It may last from a few minutes to a few hours at a time.
And then over time, the arrhythmias become more persistent, which means AFib is present. As for the causes or risk factors,
the most common ones are having high blood pressure, especially uncorrected for many years, diabetes, being overweight, and having sleep apnea.
Over the years, AFib cases have been on the rise because of a larger aging population. Treatments do vary from patient to patient, and with greater medical technology, there is a greater level of hope for those who have this condition.
Some people may do very well with medications. Others may require procedures such as cardioversion, where we use an electrical current to restore the normal rhythm.
When these options are not working as well, there is another high-tech technique.
We use ablation techniques, catheter ablation, where we insert catheters from the vein of the leg and insert the catheters into the heart.
Which gives Dr. Cassis the ability to freeze the area that is the trigger of AFib. Technology opening up new arteries to saving lives.
The last several years we've seen a lot of technology being used to help us and guide us to be able to reach the areas of the heart that are triggering the atrial fibrillation.
Meaning greater success rates for a growing condition. For this week's Doc Talk, I'm Chris Allen.